second session. But violence against doctors. Dr. Vitull Gupta
Yes.
is a
Good morning.
human rights activist, member executive committee, Cardiological Society of India, fellow of ICP, CSI, SCP, and role of honor in table tennis, lawn tennis, and he had organized APICON, and there are several papers in his credit. Now I invite Professor Vitull Gupta to start with talk. Dr. Vitull, please.
Yes. Can you hear me?
Hello,
Yes. Can you hear me?
please unmute. You are not audible.
Okay. Yes. Good morning, sir.
Good morning.
So I must thank Dr. Tiwari for including this rather important topic which got personified in post-COVID era. So it is very, very important that we discuss violence against doctors, what are the causes, effects, and the possible solutions. So humans are being considered to be best creation of God. But doctors are considered to be created by God to take care of sufferings of humans. So doctors are considered next to God. Like never before, a chronic, progressive, and fast dissatisfaction is creeping in doctor-patient relationship. And in last 2 decades or so, slowly but steadily, the doctor-patient relationship has attained the shape of a crisis or a demon in 21st century, especially in post-COVID era. So in post-COVID era, like never before, the doctor-patient relationship or doctor-society relationship has been affected. Today, the general perception is that commercial considerations override the professional, ethical, and social commitments of medical professionals. And this phrase, Doctor, I salute you, you are like a Yamraj, god of death. But while Yamraj takes away only life, doctor takes away patient's life as well as his money. So this statement sums it all what is the public perception today. So we are considered this picture in every public mind or in the media. And so there is a constant conflict whether the doctors are considered as Superman or they are like Yamraj. So violence against doctors, I will be presenting an overview in next few slides. No physician, however conscious or careful, can tell what day or hour he may not be the object of some undeserved attack, malicious accusation, blackmail, or suit of damage. These words were written 135 years ago and they are much more relevant today than before. Over the years, especially during COVID-19 period, violence against doctors is making more and more headlines across the world, including India, like never before. So discussing in pre-COVID era, when we were students 4 decades ago, violence against doctors was no news or not discussed in medical journals. We have not heard of any incidents where the doctors were assaulted. But now the data suggests that health professionals are 4 times more vulnerable to face violence as compared to other professionals. Over 75% of doctors face some kind of violence, verbal abuse being more than the physical violence. However, there is limited research on violence in healthcare settings against physicians in India. But this was a IMA study which exposed the extent of violence that over 80% of doctors are stressed out in their profession. So in post-COVID era has been a turning point in doctor-patient society relationship, exposing very dangerous contradictions. In India, on one hand, health workers have been celebrated as heroes, and on the other hand, stories of health workers facing numerous type of violences against them. So these were the routine pictures or stories on television which we came across during the COVID era. So doctors were all out protesting the violence and the treatment they met from the society all over India, especially in post-COVID era. The probable causes leading to deteriorated doctor-patient relationship and violence against doctors, we are going to again have a light in next few slides. The reason for violence against doctors prevalent in COVID-19 era got personified in post-COVID era. That is what we are going to discuss. Change in public perception during COVID pandemic was very, very important as public perceived healthcare workers as public health hazard, especially against all the workers in COVID centers, leading to disinformation, conspiracy theories, contributing to demonizing the healthcare workers and increased cases of violence against them. Erosion in medical ethics in other very important aspect which has forced changes in our healthcare delivery, raising complex ethical issues, attracting widespread public and media attention. Increasing privatization and corporatization has changed our ethical and moral standards. Under Consumer Protection Act, healthcare delivery has become a business and patients are now consumers. Diseases are treated in package deals, various incentives, festival offers are given out like travel holidays, and these type of advertisements we see daily in and out in newspapers as posters also. So corporate ethics are focused on profits rather than patients' welfare, and professional ethics are focused on patients' welfare rather than profits. So what is happening? Medical profession is in dilemma. So it doesn't know whether to follow the corporate ethics or to follow the professional ethics. So ultimately, the doctors are coming out bruised and affected in this society. Private healthcare focuses on profit, leading to increased greed, unethical practices, deteriorating in patient-doctor relationship. So when moral values are in conflict, the result may be an ethical dilemma or crisis. So this picture represents the confused mass of protoplasm in our society that we don't know what to do, which wire is leading where. Corruption in healthcare system is another very, very important aspect because increasing corruption and lust for money has paved the way for unethical practices both in public as well as private healthcare system, destroying the holy patient-doctor relationship. But the face of corruption is different in government and private institutions. So doctors in public hospitals are prescribing costly and unnecessary medications, laboratory tests, cuts and commissions, foreign tours, costly gifts, leading to loss of faith in medical community, and this is being represented daily in our newspapers or news channels. Reports that private doctors are keeping patients unnecessarily in hospitals, irrational expenses, therapeutics, overprescription, unnecessary investigations are leading to expensive, unaffordable treatment for many, again leading to deranged or affected doctor-patient relationship. Even the medical colleges are charging money for insured patients in light of corruption and what environment they are going to provide to teach the medical students if they are indulging themselves. So these type of, again, newspaper reports are very frequent. That is why patients correctly wonder if doctors are caring for them or their money, eroding the long-lasting trust. Commercialization of medical education, corporatization of medical education has leading phenomenon unregulated growth of private medical colleges with illegal and unethical practices adversely affecting the quality of doctors and their mentality. Commercialization of education has converted medical students into more materialistic, self-centered, without sacrifice, leading to disturbed doctor-patient relationship. And once a doctor is spending 5 crores on medical education, how you can expect him to be, not charging money from their patients. Corporatization of healthcare are promoting corporate ethics which are focused on profits rather than patients' welfare. From the era of humble family physicians and endpoint to all patients' need, we have progressed to era of the five-star corporate hospitals with high-tech facilities but inadequate patient satisfaction. Such a scenario is reversely affecting the doctor-patient relationship. Inequality in healthcare delivery is again an important aspect because India has one of the most fragmented and commercialized healthcare system in the world with great inequalities where world-class private healthcare is there along with poor public healthcare coexisting leading to dissatisfaction both among poor and rich patients for different reasons. So we have different dissatisfaction level with private as well as with public healthcare system. Health is for those who can pay. Because of inequality in healthcare system, doctors are becoming victim of all angers of frustration of the patients, both rich and poor, depending on whether doctor is working in a corporate hospital or doctor is working in a public hospital, but they are going to be affected both ways. So these are the pictures which are depicting technological development in medical science has again led to dissatisfaction because of high expectations amidst high cost. Regulatory vacuum of law enforcing agencies is again leading to lack of public faith in judicial system and inactivity of police compelling them for instant justice. Social degradation and intolerance in society, there is ever increasing tendency of relatives to blame doctors for any death, maybe because of lack of medical knowledge, ineffective communication, economic stress, and greed to extract money or blackmail doctor. Lack of communication and empathy, very important factor which is leading to loss of trust and violence against doctors. Negative media projection, media often projects the poor image of medical professions leading to again demonization of medical profession rather than projecting any good doctor as role models. So these are the negative media reports. We seldom find any good media report in the media. So all these factors are forcing the people to think, can you trust your doctor? So when this question comes, it deteriorates the doctor-patient relationship. Change in medical curriculum again is a very important factor. Increased literacy, awareness, accessibility of information is leading patients to ask questions to the doctors and leading to confrontation. Failure of medical intellectuals to speak against malpractices. Most of the prominent doctors, they don't speak against malpractices, again leading to decreased credibility. So what are the effects of violence against doctors? So effects is not trivial. We can know that study from around the world act of violence has negative effect on physicians' family life, change in behavior, quality of life, short-term and long-term effects, physical and psychological state, and professional performance is affected of all the physicians coming across violence or hearing the violence against their colleagues. So in a study, 86% of physicians who experienced violence reported that it caused insomnia, depression, and other aspects. Among the coping strategies, the effect is leading doctors to not to treat serious patients, referring threatening patients to secondary services, and taking off threatening patients off their lists. So my dear friends, what is the way forward to decrease the violence against doctors? The WHO has initiated a global campaign for violence prevention. We have outlined briefly the factors affecting doctor-patient relationship which deserves our serious attention and high priority. I strongly feel that solutions to curb violence against doctors and improve doctor-patient trust cannot be isolated from other socioeconomic problems plaguing the increasing market-oriented Indian economy. So I think deteriorating patient-doctor relationship is a multifactorial and a symptom of collapsing capitalist society, social degradation, progressively increasing intolerance. So we need to address all the factors together, completely overhauling the existing economic and healthcare system, including medical education. So to conclude, my dear friends, Deteriorating doctor-patient relationship, loss of trust, and ever-increasing violence against doctors is dominating our lives like never before, especially in post-COVID era. A violent society is detrimental to well-being of the nation as a whole and in particular to the practice of humane medicine and negates all the achievements of modern medicine. It is our combined ethical responsibility to respond strongly and firmly to restore trust between doctors and patients to curb ever increasing violence against doctors. Since cause of deteriorating doctor patient relationship are multifactorial, so the solutions to restore the trust has to be integrated, multidisciplinary, where all the stakeholders should strive to transform doctors' mentality, build trust between society and medical profession, along with strong commitment and punishments for both causing violence against doctors as well as medical negligence. So we have to keep the balance. No doubt, it seems impossible, but we must do our bit before it is too late and beyond repair. So we must strive whatever we can do in our individual capacity as professional organizations or as a social person to decrease the violence against doctors and build patient doctor trust. Thank you very much. And with this, I invite you all to our annual conference, APICON Bathinda 2021 in September. Thank you, sir.
Thank you, Dr. Vitull, for nicely presentation. Can you tell me what is your personal suggestions to increase faith between the doctors and the community?
I think with all the effects, the communication and giving time to the patient is of prime importance. If you put a hand on the shoulder of the patients or relatives and give 5 minutes every day to the serious patient, you won't find any dissatisfaction. This is my personal experience in treating very, very critical patients with lot of money being spent in corporate as well as in public hospitals. So the violence occurs when there is communication gap or dissatisfaction, or we give false hope to a dying patient that deposit 2 lakhs, I will treat him and he will be okay. So that is causing the most of the problems. And if you communicate sympathetically, single most factor, if you ask me, is communication.
Okay, thank you, sir. Any questions from audience? Dr. Girijanandan, please. Any question? Sir? Okay. Okay, thank you for participating. Such a beautiful, such an important topic. Thank you, Dr. Vitull and
Thank you,
Dr.
sir.
Thank you, sir.
Thank you.